Thank you so much for letting me speak here today. I'm going to be talking a little bit more mechanistic. I'm a biologist by training, not an engineer. So it's going to be a lot of signaling and cell biology. So I hope this is a great example of how we can use these chips to uncover novel biology. The green button? Oh, thank you. Colon cancer is a complex adaptive system. We know a little bit about how the primary tumor evolves, how the tumor cells invade into the bloodstream, and how they set up the distant metastatic site, but there's so much that we don't understand. And so we're hoping to really uncover what we're missing during the metastatic cascade, which is a really great example of how I hope we can use these organ-on-chips, particularly because of the organ-like tissue architecture and function, especially when you consider all of the different cell types present within the tumor microenvironment, all of the physical forces that are very important in cancer development, and the microfluidic component as well as we start to think about this metastatic cascade. I've been working mostly with the Amulet organ-on-chips, which comprised of two channels, microfluidic channels separated by a porous membrane. In our top epithelial channel, we can layer on different types of cells. Specifically here today, I'm talking about a normal epithelium, and then we can layer on these colon cancer tumor cells that will form these spheres in the top channel. Or we can actually use patient-derived colon cancer tumor organoids I'll be talking a little bit about today, although our model is, someone else will be describing our model at a different time. In our bottom channel, we're using human umbilical vein endothelial cells. And then in this top channel, we've worked with a few different colon cancer tumor cell lines, whether the HT29s, the more aggressive HT116s, and again, like I said, patient-derived colon cancer organoids. I've described this tissue interface. I'm going to talk through a few different assays that we're using to interrogate this colon cancer on a chip, with the whole goal of modulating the tumor microenvironment, whether it be different cells, whether it be the physical forces like I'm talking about today, and then using these different assays to understand how the tumor is progressing. I'm first going to talk about an imaging-based tumor cell invasion assay, and then I'm going to go into some of the effluent analysis, whether it be cell-based effluent analysis or a metabolic approach. We've developed an imaging-based invasion assay. You can see here, we're looking at a worm's eye view of one particular region of the chip. We can see our green tumor cells in the top channel and a tube of the red endothelial cells in the bottom channel. And you can see over time from day 0 to day 6, the green colon cancer tumor cells are actually invading into the bottom membrane where they're adhering to the endothelial cells and proliferating. And we can actually quantitate that over time, with my more invasive HT116 cells invading more at the end of the experiment on day 6 than my less invasive and less aggressive HT29 cells, replicating the biology that we see from which these tumor cells were derived. In addition, that's measuring the tumor cells that have invaded into the bottom channel and adhered, but tumor cells do also slough off and can be found in circulation. And because this is a microfluidic device, we can collect the effluent, and then we can actually capture these tumor cells that had invaded into the bottom channel and end up in the endothelial effluent. They do remain viable. We can quantitate them, so we can see that we get more of these circulating tumor cells in my HT116 chips, which are my more aggressive colon cancer tumor cells, and less circulating tumor cells in my HT29 chips. In addition, we can perform some qPCRs and look at gene expressions. In this example here, we're seeing that Vimentin is increased, E-cadherin is decreased in these circulating tumor cells, suggesting that they are undergoing some epithelial to mesenchymal transition. And finally, my last assay that I'm going to be describing before we get into the cool biology is that this is a microfluidic device. We can collect the effluent and perform various analyses on the effluent. The one that we're talking about today is a mass spec-based metabolomics. So we can look at the differentially expressed metabolites. We can do over time. We can do between different perturbations, different versions of the colon cancer chips. And so when we look at the differential metabolites from the start of my experiment to the end of my experiment, we can see that there's a lot of differentially expressed metabolites present in my colon cancer chips as we compare to the non-diseased epithelial chip. When we put these through the IPA analysis, the ingenuity pathway analysis, we see a lot of TCA cycle and amino acid metabolism changes in my colon cancer chip over time. And in addition, when we map that back to colon cancer with using metabolic markers of colon cancer that we see in human patients, we can see that my 2 colon cancer chips actually map to the colon cancer disease state very significantly, with, again, my more aggressive HCT woman 6 chips mapping more significantly to the colon cancer disease state. Now then I'm using those 3 assays to then interrogate some biology here. And one of the projects that I've been working on during my graduate studies and as well as a postdoc is trying to understand how these physical forces that we see in the body that surround the tumor cell, how does that influence the colon cancer progression? There's a lot of talk about fluid flow and shear stress, especially within these organ-on-chip conferences and in the world of organ-on-chips. But we also have to think about the mechanical forces in every single organ. And that's not often very difficult to recapitulate. It's also very difficult to study. Today, I'm going to be talking about peristalsis, how food is moving through the intestine. And we can do that. We can model that with this particular organ-on-chip system, where there's a vacuum channel where vacuum is applied and released throughout the course of the experiment. And you can see here, this is a video from Emulet, actually showing the cells on the chip constraining and retracting. One of the first things that we did was we looked at the invasion, how these tumor cells are invading over time in the course of my experiment. And so I'm looking at the invasion fold change here as we compare to stretch conditions and not stretch conditions. And those last 2 bars are my colon cancer chips. And you can see that there's a 6-fold increase in invasion when the peristalsis motions are applied to these HCT116 chips. In the HT29s, we see about a 2.5-fold change. And then when we go to the patient-derived organoids, we see about a 2-fold increase in invasion as well. So this is not just a cell line phenotype. We are working to expand the number of patient-derived organoids that we're working with. But overall, big picture, if we have these mechanical deformations, these tumor cells are increasing their invasive capabilities. We looked a little bit at some of the barrier functionalities of these chips as well. We don't see any large-scale changes in tight junction formation, which is measured here by ZO1 staining between stretched and not stretched chips. And in addition, we don't see any huge deformations of the barrier functionality of these chips as well in the stretch and not stretch conditions based off of a permeability assay. We have more work to do to really characterize this, but we're not seeing huge issues in how these cells are growing in response to these mechanical deformations. And in addition, one of the cool things about the peristalsis abilities with this particular chip is that you can apply the stretching and remove it over the course of the experiment. And so we set up different perturbations that start and stop at various times of the experiment. So we could have stretching applied for 2 days and then remove this peristaltic motion, and we can have the reverse. And we can actually look at the course of the invasion and how these tumor cells are responding. And I want you to look at 2 different colors here, the blue and the green. And you can see that my green chips, we didn't have stretching at the beginning of the experiment, so we don't really see much invasion. And then on day 2, when we start this stretching, we can see the invasion really increases over the rest of the experiment. And the vice versa with this blue line here, when we do have stretching in the beginning of the experiment, we turn it off and the invasion really levels off, suggesting that this really is a plastic phenotype and they're really responding very quickly to this perturbation. In order to understand better what was going on, we went back to our mass spec-based metabolomics to understand on a bigger scale and try to focus more on what we should be looking at with this particular phenotype. And we did some differential metabolites of stretched versus not stretched effluent. Cancer came up as a very significant pathway, which is good. But we also saw neurological disease pop up, which was pretty interesting to us and made us start to research and think about the gut-brain axis and all the crosstalk that happens with the neurotransmitters from the gut all the way up to the brain and vice versa. We performed some mass spec-based metabolomics with a neurotransmitter-specific metabolite library and saw quite a few of the neurotransmitters that significantly changed between stretched and not stretched chips. GABA was very significant here with a highly increased fold change in stretch and not stretch conditions. So we decided to focus a lot of the work on GABA. And so what we're looking at here is we're looking at GABA metabolic intensities from our mass spec-based metabolomics. I'm sorry, the scale is cut off on that middle graph, but we're looking at the fold change in the top channel effluent of my chips. And you can see that in my cancerous chips, we're seeing, again, a very big fold change in the amount of GABA present coming off of these chips. So with my HCT116 chips, with my HT29 chips, as well as with my patient-derived organoids, OOUS, we're seeing about 5-fold increase in GABA in the effluent. And in addition, we can actually introduce some C13 labeled GABA into the top channel. And then we can collect the cells off of that top channel and perform mass spec-based metabolomics to see how much of this C13 labeled GABA is actually in the cells. And we can see that in my stretched cells, in purple, we see quite a bit more of this heavy labeled GABA, suggesting that these cells are not only secreting more, but they're also taking up more as well. To try to focus more of this mechanistic a little bit more, we performed some studies adding different GABA receptors, agonists or antagonists, into the top channel of the chip. This is a complicated graph, but basically I'm looking at GABA receptor A and GABA receptor B antagonists or agonists. And so if we look in the blue section of the graph, you can see I have my stretched invasion happening. So we have lots of invasion, tumor cells are invading into the bottom channel. And then when we block that with a GABA receptor A antagonist, we can see that the invasion drops significantly, which we do not see that with a GABA receptor B inhibitor, suggesting that this is a GABA receptor A mediated response. And in addition, we can also perform some immunofluorescence on the invaded cells. So the tumor cells that have invaded into the bottom channel, they've adhered, and then we can see that they stain positive for GABA receptor A and they stain negative for GABA receptor B, although my endothelial cells stain very nicely for GABA receptor B in the image on the right. So where we are with this mechanism right now is that we have this peristalsis-like motion happening. The tumor cells are responding to that mechanical force. They're secreting GABA, but they're also taking GABA receptor in, and we believe that they're metabolizing it, although we have much work to do there to understand that. And there's also some binding to GABA receptor A and some downstream signaling that, again, we need to better understand as well. But altogether, these cells are becoming more invasive. But quickly and very preliminarily, I want to ask the question about what does this ultimately mean for metastasis? Great, these cells are becoming more invasive. What does that actually mean for the secondary, more deadly tumor? And when we were doing some RNA-seq on stretched and not stretched circulating tumor cells, so remember the cells that we can collect and remain viable from the effluent, we noticed that there were quite a few different pathways that were differentially changed in the peristaltic-like conditions. One of them was these GABAergic synaptic transmission pathways, which is great compared to the other data that I've shown here. But we also saw a lot of cell adhesion and cell-to-cell interactions, integrin binding pathways as well. And so we wondered a little bit about if this mechanical motion was actually helping these cells adhere in the liver secondary metastatic tumor setting. What we can do here is we can start to think about the metastatic process and linking. Unfortunately, we're linking by hand right now these colon cancer chips with a healthy liver chip, because most of our colon cancer tumors actually metastasize to the liver. And so what we can do is we can take the effluent, we can take some of these circulating tumor cells from my colon cancer chip, and then we can flow it into the endothelial channel of a healthy liver chip and see if these cells will actually adhere to the endothelial channel and then extravasate and colonize the hepatocyte layer. And what we can see is that after a lot of optimizing, these tumor cells will actually extravasate and colonize the hepatocyte layer. And then, of course, I asked the question, what happens when you have this mechanical pressure in the colon tumor setting, how does that apply in the liver setting? And so what we did is I took some circulating tumor cells from my stretched colon cancer chips, flowed them into the liver chip, and then monitored how they actually adhered to the endothelial layer. And we can see that the stretched cells adhere more than not stretched cells on that very first day after introducing them into the liver chip. In addition, we can start to think about metastatic events by seeing by the end of my experiment how many tumor colonies are in the top channel, the hepatocyte layer of my liver chip. And we can see that in the when the cells have been stretched before they flow into the liver chip, 3 out of 4 times there's a metastatic event, whereas when the cells are not stretched, only 1 out of 4. And that means 3 out of 4 chips actually had a metastatic event. And so to conclude, this colon cancer on chip is really a great tunable model to study the role of the tumor microenvironment in cancer progression. And the tumor microenvironment that I'm talking about today is these peristaltic-like motions in which the tumor cells secrete and take up more GABA, and then they increase their invasive potential. And the future work that we're looking at here is really, hopefully all patients have peristalsis. And so what does that actually mean in terms of how treating these patients? And so we're starting to think about using these patient-derived organoids from different patients across the different colorectal cancer stages, across different mutational statuses as well, and trying to understand if all of those organoids respond the same way to these mechanical motions. And then as well, of course, we're also interested in how all of the other stromal cells, immune cells, fibroblasts as well, how do they respond in a GABAergic environment? This is a really highly collaborative effort. Everyone at the Ellison Institute has been very helpful, as well as a lot of labs at USC. We worked closely with Emulate over the years, and they've been very helpful as well. And we are funded by NCI Tissue Engineering R01. Thank you very much for your attention.
Thank you, Carly. We have time for one question. Here we go.
Hi, it's Jason from MIT. So about the stretching experiments. So I know your research actually focus on the cancer the cancer part. But can you also comment on the stretch effects on the vessel side, blood vessel side? Because I think those endothelial cells probably will also respond to the stretch, and maybe they secrete something to enhance the invasion. Thanks.
Are you talking about the endothelial cells?
Yes.
Yes, yeah, great question. And we just got back some single cell RNA-seq about that. And there's a lot of endothelial crosstalk that we're really interested in looking at. It's too preliminary right now. We're still going through all the data, but we think that the endothelial cells are really important here. And so we're hopefully following up on that. Thank you.
Thank you again, Carly, and thank you everyone for your attention.